Hello, this is Dr. Clark from the Center for Weight Loss Success. What I'd like to talk a little bit about today are some misconceptions about low-carbohydrate diets. Low-carbohydrate diets actually have a lot of misconceptions, so we're going to go through a bunch of them, but we're going to start out with the first two that I hear very commonly. The first one is ketosis dangerous? And the second is, doesn't low-carb diets make you lose bone mass, and isn't it bad for your kidneys? Okay, let's address those. First about ketosis. Now, ketosis just means you have ketones in your bloodstream. And we have ketones in our bloodstream all the time. It's just the level of ketones. Now, ketones are really just an energy source. They come from the breakdown of fat. And isn't that what you want during a weight loss plan, is to break down fat? So you actually want to have some ketones in your bloodstream so you can use them as an energy source. Now, ketosis is often confused with diabetic ketoacidosis, and that's a completely different thing, because that occurs when the ketone levels actually get about 10 times the level of what would happen in a low-carbohydrate diet. So ketosis by itself is not dangerous at all. It's just an energy source. Now, that second thing about the dangers of low-carbohydrate, and can it lead to loss of bone mass, and can it ruin your kidneys? Well, let's talk about that. Well, loss of bone mass, where that came from is that initially in low-carb diets, we saw that there was some extra calcium in the urine for people that are on low-carb diets. But long-term, what we found is that we actually absorb more calcium, and so for a little bit of calcium that's lost in the urine, there's still a positive calcium there. So we actually don't lose bone mass, we can actually improve bone mass. Kidney failure doesn't happen. Now, there's a difference between kidneys that can have low-carb diets and kidneys that shouldn't have low-carb diets. And what I mean by that is kidneys that are normal, no problem at all with having a low-carbohydrate diet. Kidneys that are abnormal, such as kidney failure patients or dialysis patients, well, that's absolutely correct. They should not be on a low-carbohydrate diet, because typically on a low-carbohydrate diet you're going to have a little more protein, and it's the protein that's the problem, because the extra nitrogen in protein the kidneys can't handle if you've got bad kidneys. But if you've got normal kidneys, actually it improves kidney function. So kind of that ketosis problem and that bone problem, potential kidney problem, there really is no problem. Remember, it's your life. Make it a healthy one.